Good afternoon, everyone, and welcome. As part of Reproductive Health Month, we are going to be doing quite a number of talks. And today we are joined by Dr. Yoks, and she's from Vitalab in KZN. So thank you very much, Doctor, for joining us.
Thank you, Leanne, for the invite. How are you?
I'm good, and yourself?
I'm good, thank you.
Good. So Doctor's going to give us a brief rundown of who she is and what does she do, if you don't mind.
Okay, so Dr. Sigu is a gynecologist who has subspecialized in reproductive medicine. So reproductive medicine encompasses a lot of things. It's fertility, it's dealing with contraception, it's dealing with menopause, just to mention a few.
Okay, thank you very much, Doctor. So we're going to talk about one of the things she mentioned is, does my contraceptive affect my fertility? So I think there's quite a big talk about that, about people don't, especially when they're dealing with infertility. Oh no, let's not go on the doctor gives them, oh no, let's go on the pill. And it's like, no, how can I go on the pill? But I'm trying to conceive. It doesn't make sense. So we're going to talk about that and how it does affect your fertility, or if it does. So, our first question, Doctor, is how long does it typically take for fertility to return after stopping fertility types of contraceptives? Example, pills, the IUD injection.
Okay. I think you mentioned something that I just want to touch up on. You
Yes,
asked, does contraception affect fertility?
yes.
Let's just get things straight. Contraception does not affect fertility.
Yeah.
All right. Now, let's just dive in. When we're talking contraception, we're talking about barrier contraception, that is the condom, which we're not going to discuss here.
Yes.
We're talking about the pill, that is the hormonal contraception. We're talking about the intrauterine device, whether it's the medicated type or the copper device. And then we're also talking about the injectables. So the only contraceptive pill that might delay fertility per se is the injectable. All the other forms of contraception do not delay fertility at all. So when you are taking the pill, even though you are not seeing it, the ovaries, you do ovulate, but what's happening is the lining is so thin and nothing will happen. So the pill per se doesn't really stop ovulation that much for people. The Mirena, which is a medicated intrauterine contraceptive device, it acts on the lining of the womb. You continue to ovulate whilst you are using the Mirena. But the only thing that is different is with the Mirena, it also makes the lining of the uterus to be thin. What happens when you're using the copper IUCD, that is the device that's normally found in many of our government setups? What happens with the copper IUCD? It also doesn't delay or it doesn't affect the ovulation. But what happens is the copper device itself, it affects the motility of the sperm within the uterine cavity, as well as it also makes the mucus itself of the the female secretions to be spermicidal. So it affects the sperm from moving up.
Okay, thank you very much, Doctor. And then our next question is, are there any contraceptives that can have a longer lasting impact on fertility even after discontinuation?
Yes. So as I've mentioned, the injectable is the one that tends to linger on. So we normally say that when you've used the injection, it can take up to a year before your normal cycles return. So some people, when they are using the injectable, they don't get periods at all. Some people do get periods. Some people might have spotting here and there. But the moment you stop with the injection, let's say you are due to repeat and you don't repeat, it doesn't necessarily mean that you're gonna ovulate immediately because it might take up to 6 months, but safely to say a year after you've stopped with the injectable, you should expect your normal ovulation to start happening.
Okay, thank you, doctor. Our next one is, can long-term use of contraceptives affect egg quality or ovarian reserve?
So, when you are using contraceptions, remember you continue to ovulate, right? So let's just talk a little bit about ovarian reserves. Ovarian reserves, each person is born with a set number of ovarian reserves. So when you continue to ovulate, you are losing some of the ovarian reserves. So being on the contraception, it doesn't necessarily mean that it's gonna affect the ovarian reserves because you are on the contraception. It was going to be affected anyway. That's one thing we need to understand. However, there is new evidence that is coming up to say that when we do measure the ovarian reserves in people that are on the pill, we need, if it's low, what we need to do is we need to wait 2 months and repeat, because in some people it's been found that when you are on the pill, it can sort of make the ovarian reserves appear to be lower than how they normally are.
Okay.
And then when it comes to the quality, does being on contraceptives affect the quality of the egg? The short answer there is no. What affects the quality of the eggs? It could be aging, it could be exposure to things like radiation or to things like chemotherapy, the medication that is used for cancer cells.
Okay. Thank you, doctor. Is it normal to experience irregular cycles after stopping contraception, and how long should this last?
So that might happen. What we always need to remember is, especially if we're using the pill, we use it a lot to regulate the cycles. So once you stop using the pill, if you had irregular cycles, you might go back to having irregular cycles. So that means some kind of a hormonal medication might also need to be used to sort of regulate you. When it comes to the Mirena, some people, when they are on the Mirena itself, they do experience spotting, but that spotting is within the first 6 months. So once you've stopped using the Mirena, then your cycles should run as they were before. So the answer is, if you had irregular periods prior to using any form of contraception, when you stop the contraception, your cycle might go back to what it was before for some people. However, there are certain things that we also need to take into consideration is the weight itself, because some people do pick up weight, not because of the contraception, that I need to make it clear, but because of aging and all of that. So now when they stop with the contraception, they find that, their cycles are irregular, meaning one of the culprits is weight gain.
Okay. Thank you, doctor. Our last two questions is, are there any health checks or preparations recommended before trying to conceive after using contraceptives?
Okay. So one of the things that we always make sure that are happen, or we need to make sure that are happening, your health itself, you need to be a healthy individual.
Yeah.
Secondly, you need to make sure that you've been doing your pap smears even once you are on the contraception. And then when you are thinking of stopping the contraception, it's always ideal to do things like checking if the tubes are working out normally, so that once you decide to stop the form of medication, there are no delays. Sometimes we need to operate. So if we find that we need to operate, so we can do that whilst you are still on the contraceptive pill, and then so that once you embark on the journey is smooth sailing, hopefully.
Thank you, doctor. Our very last question is, what are the best steps to take when transitioning off contraceptives to optimize fertility?
Okay, so as I've mentioned, make sure that you are healthy in terms of your body weight must be in a good thing. Try and avoid stress as much as possible, because stress has an impact on fertility. Make sure that you are also mentally ready to start conceiving. We do emphasize that pre-pregnancy mental wellness before you even embark on pregnancy, because the journey itself can be stressful, more especially if you've been told that there is a diagnosis that further needs treatment. So it becomes a joyous occasion, becomes such a tedious and stressful journey.
Thank you very
So it's
much.
always best to make sure that you are in good health. However, things that I always need to touch up on, people that have been diagnosed with endometriosis, they need to understand that when they stop having or using any form of hormonal contraception or hormonal therapy, then the endometriosis is going to come back. So we often advise that you stop treatment for endometriosis when you know that you're jumping straight into fertility. Otherwise, the pain and everything do come back.
Yeah.
People with polycystic ovarian syndrome, they also need to make sure that their blood sugar levels have been checked before, because we know that polycystic ovarian syndrome may lead to diabetes in some people. So
Yeah.
whilst you are busy with the contraceptive pills, you also need to make sure that you don't neglect having regular checkups about your blood sugar and all the other aspects of your.
Thank you. I've got one more question, if you don't mind me asking, and I'm only
Yes.
asking this because we receive this question a lot, and I obviously always say to them, I cannot answer, please ask a doctor. So if you can answer this question, a lot of times when women go to a fertility specialist, and one of the first things that the specialist does, and I do know why they do it, but one of the first things the specialist does is they might put them on contraceptive pills for maybe a month or two. Can you please explain why in certain cases it is done?
Well, it depends on what is happening. So if you have irregular period or there are investigations that need to be done, so we'll put you on the contraceptive pills, mainly for the investigations to be done, especially if you've got fixed time frames. So it's just to work around and see how fast to speed up the investigation on your side so that we speed up the process. Otherwise, it doesn't necessarily mean that we put you on the contraceptive pill to assist with the fertility process itself.
Okay, thank you very much. Like I said, I'm just asking because we get this question a lot, and I was like, oh, we can't answer, unfortunately. It's between your
Okay,
doctor, and your
no,
doctor
it's
knows
mainly,
what they're doing, you know?
yes, it's mainly to assist with the investigation process. However, the one other thing that we mustn't forget is the partners, because women often go alone and have all the investigations done on them before the male partner is done. So the couple needs to be investigated at the same time when we're doing fertility.
Thank you very much, Dr. Yoks. Thank you for joining us today. And Dr. Yoks, if they want to get a hold of you, how do they get a hold of you?
Okay, so I'm based at Vitalab in Durban. We are based at Umhlanga at number 2 Tosville Crescent. If one goes onto the website for Vitalab, you would find the information for the Joburg branch and for us. But our telephone number is 031 880 1700. 031 880 1700. However, people can also go onto the website, and we are also available on Twitter and Instagram.
Instagram and Facebook,
Yes.
and they're
And
also
Facebook.
on the Fertility Solutions website. You'll go under KZN, you'll find the details there, or you can always you can DM me or call me as you guys would do, and get hold of Dr. Yoks. So thank you very much, Dr. Yoks, and I really appreciate your time this afternoon. Have a great day
Thank you so
further.
much, Leanne. Have a
Thank
lovely
you.
afternoon. You too.
Thanks. Bye.